5. Understanding the role of diversity issues in the therapeutic relationship. 6. Describe what is involved in acquiring competency as a multicultural counselor. 7. Identify issues faced by beginning therapists. Introduction. One of the most important instruments you have to work with a counselor is yourself as a person. In preparing for counseling, you will acquire knowledge about the theories of personality and psychotherapy, learn assessment and intervention techniques, and discover the dynamics of human behavior. Such knowledge and skills are essential, but by themselves, they are not sufficient for establishing and maintaining effective therapeutic relationships. To every therapy session, we bring our human qualities and the experiences that have influenced us. In my judgment, this human dimension is one of the most powerful influences on the therapeutic process. A good way to begin your study of contemporary counseling theory is by reflecting on the personal issues raised in this chapter. By remaining open to self-evaluation, you not only expand your awareness of self, but also build a foundation for developing your abilities and skills as a professional. The theme of this chapter is that the person and the professional are intertwined faces that cannot be separated in reality. We know clinically and scientifically that the person of therapist and the therapeutic relationship contribute to therapy outcome at least as much as the particular treatment method used. Duncan, Miller, Wempold, and Hubble, 2010, Elkins, 2016, Norcross, 2011. Visit sengagebrain.com or watch the DVD for the video program on Chapter 2, Theory and Practice of Counseling and Psychotherapy. The Cage of Stand and Lecturates. I suggest that you view the brief lecture for each chapter prior to reading the chapter. The counselor as a therapeutic person. Counseling is an intimate form of learning, and it demands a practitioner who is willing to be an authentic person in the therapeutic relationship. It is within the context of such a person-to-person connection that the client experiences growth. If we hide behind the safety of our professional role, our clients will likely keep themselves hidden from us. If we strive for technical expertise alone and leave our own reactions to self out of our work, the result is likely to be ineffective counseling. Our own genuineness can have a significant effect on our relationship with our clients. If we are willing to look at our lives and make the changes we want, we can model that process by the way we reveal them ourselves and respond to our clients. If we are inauthentic, we will have difficulty establishing a working alliance with our clients. If we model authenticity by engaging in inappropriate self-disclosure, our client will tend to be honest with us as well. I believe that we are psychotherapist is directly relates to his or her ability to establish and maintain effective therapy relationships with the clients. But what does the research reveal about the role of the counselor as a person and the therapeutic relationship on psychotherapy outcome? An abundant research indicates the centrality of the person of the therapist as a primary factor in successful therapy. The person of this psychotherapist is inextricably intertwined, intertwined, intertwined with the outcome of psychotherapy. C. Elkins, 2016, Lampert, 2011, Norcross and Lambert, 2011, Norcross and Wempold, 2011. Clients place more value on the personality of the therapist than on the specific techniques used. Indeed, evidence-based therapy relationships are critical to the psychotherapy endure. Techniques themselves have limited importance in the therapeutic process. When polled to in 2001, conducted a meta-analysis of many research studies on therapeutic effectiveness and found that the personal and interpersonal components are essential to effective psychotherapy, whereas the techniques have a relatively little effect on the therapeutic outcome. The contextual factors, the alliance relationship, and the personal and the interpersonal skills of the therapist, client agency, and the extra therapeutic factors are the primary determinant of a therapeutic outcome. This research supports what humanistic psychologists have maintained for years. It is not theories and techniques that heal the suffering client, but the human dimension of therapy and the meetings that occur between the therapist and the client as they work together. Elkins, 2009, page 882. In short, both the therapy relationship and the therapy method used influence the outcome of a treatment, but it essential that the methods used to support the therapeutic relationship being formed with the client.